Hi, everyone, and welcome back to another podcast with the NCIHC Languages of Lower Diffusion Work Group. I'm your host, Jason Norton, and today I have a very special guest with me and a special announcement. Today I have with me Maria Gaspar, who is an exceptional interpreter in the field, not only in healthcare, but in other fields as well. Maria is a certified Spanish interpreter as well as a Chuj interpreter, Chuj being an indigenous Mayan language from Guatemala. I've had the privilege of working alongside Maria and presenting on different topics regarding indigenous languages with Maria. And I have asked Maria if she would be willing to sit as a co-chair for the Languages of Lower Diffusion work group through NCIHC, and she has graciously accepted. So first of all, thank you, Maria. Thank you for being here today. Thank you for agreeing to co-chair this with me. I think I mentioned as I first took on this role that one of the things I really wanted to focus on was bringing in more actual Indigenous people to have the voice and also the platform to really address these issues. I'm happy to leverage my experience and help out in ways that I can, but I feel that it's very important to actually bring in Indigenous people who not only have the experience and knowledge, but are from those communities and are therefore going to be able to help best. So, Maria, thank you so much for being here today.
Thank you so much, Jace. It is a pleasure being here, and I am just very excited and privileged to have given this opportunity. And I'm just from my experience and from coming from where I'm coming from, I've seen quite a few things along the way as training and getting certified as an Indigenous interpreter. So there are a lot of things that we can learn together and share. And we are hoping that this will help us pass down the word and educate other colleagues. And I'm here happy to help out as much as I can and give in a little bit of my experience and share it with others so that we can be a better interpreter, which is our purpose, because I feel that that is my purpose once I found out that this was a gift that I could use to help others. So I am very happy and thank you for the opportunity of being part of this project. And we're hoping to do good work as best as I can. Thank you so much,
Yeah,
and thank you for
no,
having
no,
me here.
no. Thank you very much. And again, we're just really excited to have you. So, I know that Maria, you've been on this podcast before with David, but for anyone who maybe is hearing your story for the first time, I think it's really important to get a little bit more information about you and your story. I've heard your story, and it's absolutely incredible. It's inspiring, not only to, Indigenous communities and Indigenous persons who might be thinking about how can I leverage my skills to be able to help my community, but really to any interpreter, right? As you said, you not only do Spanish to English interpretation, but you also are doing Chuch interpretation. So why don't you, if you wouldn't mind, tell us your story. What's your story? Where did you come from, and how did you get to this point where you're at right now?
It's been a long process, a long journey, and I was born into a Chu community, San Sebastian Cuatán, my hometown, and grew up speaking Chu only until the age of 8, where I was sent to the near city, Huehuetenango, to go to school. And I've shared a little bit of my story before, and I get emotional every time I remember because it's one thing hearing from someone and another thing living it yourself. So I do get very emotional when sharing it, but I also at the same time want to share it because I want others to see that having an indigenous language is nothing to be ashamed of, which I felt for a while when I could not understand another language, when especially moving to the big city, going to school, I faced some bullying because I couldn't understand instructions from the teachers, from classmates. And there, I have some really embarrassing and sad memories because of not being able to understand and fit in. And maybe some of you have heard, but in our town, they use this word indito. That is a way of saying person is useless. It's an indigenous person, but that's a very diminishing word to call
Hmm.
your fellow Guatemalan or wherever.
Hmm.
And
And
so
that
this,
basically means like little Indian, basically, right? That's
yes,
essentially what the translation would be, which, yeah,
yes,
obviously, a
but it's,
very diminutive and very derogatory. Yes.
yes. So for first year or two, it was very hard, but I adjusted, started learning, and um, after a few years, I moved to the US and as a teenager and had to start learning English. At this time, during those years between my 8 years old until about 16, 17. So sometimes during that time, I avoided speaking my language
Hmm.
because of the same thing. And I did feel embarrassed of having this language. People will look
Yep.
at I- I'm thinking people look at me weird because of the way I speak or with
Mm.
or of my clothing. I still wear my typical clothing from Guatemala, but then after a while I just stopped doing it because of the way I felt for
Right.
being
Right.
for where I'm from. But as the years passed, I learned English and started going to school. As an adult, I didn't know then the importance of education. So later on, I completed my education as an adult. So coming from this background has helped me face challenges, but also thrive during those hard times. And I now, when I found out that I could use my language to help others and living it personally, I know how hard it can be, not understanding what you're being asked, a simple instruction you don't understand, and you end up doing something different. And then facing that embarrassment afterwards. So
Hmm.
it was very hard, but I'm thankful that in some way, I'm thankful that I've went through that to learn how it is exactly to live it, because that way I know how to help others. As an
Yep.
interpreter today, I am thankful that I was given this opportunity to help others who are facing those exact same challenges that I once
Hmm.
faced. So it's been a long journey, but I'm very thankful to be part of the interpreting world once I found it.
Yeah. Well, again, I mean, what an inspiring story to have persevered through, this racism persecution that you had to face. It really speaks to your character to be able to push through that and still hold on to your cultural identity and your language in a meaningful way. I think it's, again, really important to have people like you you've been like you said, you've been on both sides. You know what it's like. I want to touch real quickly on that aspect of shame. One of the issues that we encounter quite a bit of is this idea that Indigenous communities have been and put under this shame, right? Unfairly for generations to the point now where it's essentially generational trauma that they have to live with, where they are ashamed of their language. They don't want to be made fun of. I hear stories all the time of parents who say, I'm not going to teach you our Indigenous language because I don't want you to be made fun of. And there's sort of like quote unquote no point to learning our language because it's not going to do you any good, right? You can't get a job with
Right.
it. So I want to talk about how that affects somebody who maybe is experiencing that shame, and goes to the doctor, for example. Something that I've experienced is the providers will sometimes, or maybe the interpreters will maybe get a sense that, I'm not sure you're understanding fully. And we're speaking in Spanish, but I feel that you maybe are not getting the message. And so I'm going to ask you, right? I'm going to say, is Spanish your best language, right? And the story that I hear quite frequently is that, people will say, yes, yes,
Mm.
Spanish, I do speak Spanish, and Spanish is my best language. Can you shed a little bit of light on this for us? Is this something you think happens commonly with Indigenous communities where some of that shame is so prevalent that they are even in a situation like in a hospital or healthcare situation, they may be hesitant to, say that they speak an Indigenous language?
Yes, and I have seen it a lot. I live in a city where there's a large, gonna kind of focus on Chuj because that's the community I work with the most. But
Yep.
there's also many other indigenous groups around here. But Chuj is one large indigenous group that's in the city where I live, and so the healthcare organization, we see a lot of those patients, and I work with them a lot. And yes, I see that all the time where they say, where they get asked, is is Spanish your best language? They said yes. And or I have encountered some over the telephone where I know for a fact that their primary language is Chuj. That's why I get called in
Hmm.
the first place. But then
Right.
because they do feel that shame of, oh, they're going to think that I'm less than they are, so they get asked, is Chuj or Spanish your best language? They said no, it's Chuj. But I'm right there, and I can tell of the way they're speaking that Spanish is not their primary language. But because of that same reason of feeling insecure, of
Hmm.
what are they going to say, or are they going to make fun of me? Are they going to make me
Hmm.
less? So I'm just going to say yes, because they don't have that knowledge of the necessity, or how important it is that you understand things in your language as best as you can, so that it is important that you ask for the language that you speak the most at home, or your
Hmm.
primary language.
Right.
Yes, I did mention this before. Yes, most of them will understand some Spanish, some basic Spanish, but that
Right.
does not mean that that's their primary language. So
Right.
it's and that's where I think that it is up to me and others who have the same background as me to teach them, or as much as we can reach them or other colleagues about the
Sure.
importance of this. So it's very, very common to say this.
Yep. And something that I've also seen, there's that sort of shame aspect and not wanting to be, as you say, like less than, right? I think it's fair to say that speaking Spanish is sort of like a status symbol, right? If
Right.
you speak Spanish, it means you're educated, right? And again, they've been, people in Indigenous communities have been put down for so long where it's like, oh, you can't even speak
That's
Spanish. You're not educated, you're less than, right? Exactly like you said.
Yes, and that has
And
a lot to do with that, because of that mentality that we have as an indigenous. So they do have that feeling that you have no education. You speak an indigenous language, you're like automatically have no education. You are worth less than others. So
yep.
there's that somewhere in the mind.
So yeah, I think that the shame is a huge issue. And I think again, like we talked about, the status of wanting to not be sort of labeled as uneducated or less than, it's important to people. And so they want to be able to speak Spanish. And just like you said, they do have limited proficiency in Spanish. Many people speak Spanish pretty well if you're talking about, work or maybe some
Hmm.
other different categories. But as you know, when you learn another language, you can be really good at talking about certain things, but then you talk about another thing that you've never really talked about in this language you've learned, and it becomes a lot harder. And maybe you understand quite a bit, but you can't express yourself as much. Or maybe you're able to express yourself a decent amount, but you're not able to understand. So it's
And
it's
that is so
extremely.
correct. And
Yep.
the other way I look at it is just like me and you, just like you mentioned, we
Right.
are we have knowledge in one field, for
Hmm.
instance, as an interpreter, but that
Yep.
doesn't mean you can be a legal interpreter. So
Sure.
it works
Sure.
similarly for the
Right.
languages.
Yep. And then again, I think it's important to mention too that in my understanding and my experience, and I think this is pretty accurate, is that in Guatemala, there's no interpreters for someone who speaks Chuj. If you go to like a predominantly Spanish speaking hospital, right? There's no laws like we have here in the United States where people are, supposed to get language access. It's not really a thing, and so it may not even be a concept of, you know, that is even possible in their minds because they think, this would never happen in Guatemala, so we're in the United States, right? Why?
Hmm.
Certainly, it's not going to happen here, so I'm not even going to ask. I think that's another potential issue. I also think that it's really, in Spanish, the way that people refer to indigenous languages is they call them dialects. And even here in the United States, most people that I come across call indigenous languages of any kind, really, they use the word dialect. And that's a huge issue that we at Maya Bridge are working tirelessly to try to combat because it has negative consequences. The first consequence, I think, is that somebody may, from an indigenous community, they may not consider their indigenous language to be a language. And so when
Yes.
someone asks, for example, what language do you speak and understand the best? Right? In Spanish, they would say, ¿Qué idioma, cuál idioma hablas, right? Lo mejor, or whatever. They ask, what's your best language? They're using a word that they don't associate with their language,
Hmm.
right? Because people have taught them, okay, well, Spanish is a language, but what you speak at home is not it's a dialect, right? And so I think, that can affect people as well. When they're asked, what language do you speak? They will say, well, the only language I speak is Spanish. And in the back of their mind, they may think, well, I speak my dialect, but they're not asking about that. They're asking what language I speak, right? And so, one of the things we're trying to educate people to say, hey, we have to stop using the word dialect, right? It's not the way that it's being used is inappropriate. It's wrong. It's not technically correct either. But it makes it so that you're putting these languages in another category to try
Hmm.
and, sort of imply that they are less than in some way, right? Oh, well, there's not that many speakers, or they don't even have a written language very much, or whatever the reasoning may be that you would call it, you would consider it a dialect. You're incorrectly grouping these languages together and sort of disassociating them from being actual languages. And I think that it has negative consequences with actual everyday people because they start to think of their language as not really a language. Um, so, as we've presented on this topic before, and it's extremely important that people be aware of that because then instead of saying, what language in Spanish, you can use other words maybe that will help them to understand that you are talking about their
Hmm.
language, right? Like lengua, right? And I think even in some cases, if you're really struggling, it may be appropriate to ask them, do you speak a dialect so that they will understand? And then I think it's important to then correct that, as you go. But in the moment, you may have to ask, well, okay, you're saying you don't speak any other language. Do you speak a dialect? And that might register, oh, yeah, I do, right? Because that's the way they think about it. Um,
That's true.
Yeah. And so, all of these things, it's extremely important to educate our fellow interpreters on, as you mentioned, because, we have to know the nuances of, why, it seems like they're not really understanding, but they're pretty adamant, right? That they're understanding everything or that they are, they speak Spanish. So it's really important to, like you said, to raise that awareness, and to help people understand that. I want
Yes.
and then I want to mention too, I think another issue, and I think you would agree with me on this. Somebody may be pretty comfortable in Spanish. For example, I'm pretty comfortable in Spanish, right? But if I'm really, really sick in a foreign country and in a predominantly Spanish speaking country, my mind is not at full capacity And my instinct is going to be, I want to speak English. That's my native language. And so I think that's another issue of like, well, they may be, pretty good at Spanish, but they're really sick right now, right? And so their mind wants to revert to what's most comfortable. And so I wanted to ask if, your thoughts on that, if you think that if you've experienced that personally or you've seen that where, being in these critical or maybe even not sick, right? Maybe you're really nervous because it's a court hearing. You're pretty good at Spanish or English or whatever, but in the moment, it's a lot more stressful. And when we're under that stress, we want, that comfort of our native language.
Yes, and like I mentioned before, I'm a Spanish interpreter, Spanish Chuj interpreter, and Spanish English, Chuj and English. So I've had the opportunity of seeing it on both sides. So I I've had the I've had times where at the hospital I'm working in person,
Hmm.
and I come into an encounter, and it happens to be a Chuj speaker. I hear them speaking, so
Hmm.
I mentioned to the doctor, oh, they speak Chuj, which I also speak. So
Right.
so I let the doctor be aware, and that way he can ask, or I help him ask the best way, and ask them which language are you more comfortable. I speak your language, and
Hmm.
most uh if not every time, most of the times, oh, they said, oh, you speak Chuj, we are more comfortable in Chuj, let's do Chuj. So I'm happy to, and I can when I'm there in person, I can see the relief on their
Hmm.
faces when, oh, there's someone who speaks our language, we can speak freely. And even not, and even Spanish speakers, I do a lot of medical in person, so, and they speak pretty well English, but when
Hmm.
they're being seen by a doctor, they say, you know what, we want to be able to understand everything, so
Hmm.
go ahead and
Hmm.
use the interpreter so that we can get all the information in our native language. We might speak some pretty good English, but we prefer the interpreter. So it's it is important to have the language interpreter in their language, and
Yep.
most importantly in these indigenous languages that are not very known of. And like I said, it is our job to the ones that we have who have the knowledge about them, to educate our colleagues and providers as we go.
Hmm.
I've been able to do that at times when I get the chance, and educate doctors and
Yep.
colleagues, because not all Spanish English interpreters are aware, like you said
Yep.
earlier. They're not all aware that there are these indigenous languages, because they might come from the capital city of the country where they have
Sure.
never heard of them before. I've worked with Spanish interpreters colleagues that
Right.
had no idea until I talked to them about
Yeah.
my language,
Yep.
and they're like, "Oh, that's a thing." I said, "Yes." so so I see that, yes, there is a need. There's a lot
Yep.
of colleagues that have no idea, and so what we're doing here is it's a really good way and opportunity to reach as many as we can, and educating our colleagues wherever we
Yeah.
go.
Yeah. Well, thank you so much. And you're absolutely right. I think one of the big issues is that, Spanish is a pretty relatively like global sort of monolithic language. So you have, tons of interpreters who are from Colombia or Venezuela or
Hmm.
Mexico or wherever. And so somebody who's from a country, like let's say Argentina, for example, there's not quite as much of an indigenous sort of presence there currently, present day, which means that they don't have as much exposure to it, so they're not aware, right? And I
Yes.
think you're absolutely right that the healthcare physicians, they're even less aware. And so they kind of are depending on Spanish language interpreters to be able to flag or identify if that comes up. They're depending on Spanish interpreters to make them aware of that because they have zero context. And so even, the thing that we're trying to raise the awareness about is that even if you don't have the awareness, I don't, maybe somebody I don't know anything about Indigenous languages. I'm from an area where I'm not exposed to that. My perception is, that I don't really have any exposure to Indigenous languages. Um, the goal is to be able to identify when someone is speaking it as not a primary language, which I think we can all pretty well do. It's a pretty sort of intrinsic trait that we have uh, as human beings to be able to kind of gather if somebody is speaking a language is not their primary language. It's not too difficult typically to tell based on, maybe like an accent, based on, less confident usage of grammar or less correct usage of like grammar, vocabulary, verbs, things like that. It's relatively easy for us to be able to say, I think this person is speaking this language as a second language. Sometimes it may be that it is their primary language, but they have very low education levels. And so they, speak differently than you might expect. But in any case, you can tell if
Yes.
someone, usually, you can start to tell if someone's having a hard time understanding. Another thing to look for that I always tell people, if you're speaking to the husband and the mom is the one there and she's in labor, that's automatically a good sign that there's something else going on. If the husband is the one
Mhm.
who says, "Oh, talk to me," you can pretty well tell that something's going on, and we need to find out what the real language is because we wouldn't do that for somebody who speaks Spanish, right? We would get a Spanish interpreter, and if the husband is good at English, then he can communicate a lot in English. Um, but we need the Spanish to be able to ensure, right? And I think somebody like you is a great
Yes.
example because you can come in, and if somebody is more comfortable in Spanish in certain situations, you can speak to them in Spanish. But then if you're sensing, oh, they're not really understanding this concept, you can switch into Chu, and they can say, oh yeah, okay, and now I'm understanding this part in Chu. Um, so yeah, I think that there's, like you said, a lot of work to do to educate our fellow interpreters, particularly of more dominant languages like Spanish. And this happens with other languages as well, right? Spanish is probably the
Hmm.
most common where it would happen in the United States, but it can happen with French, with African languages. It can happen with Russian, with
Yes.
Central Asian languages. It can happen with Mandarin, with languages from, China and other areas of the world. So all of us as interpreters of a more dominant language need to know how to look for these signs, and then we need to know what to do. Um, you know, we have presented on this topic before, and it's surprising how people don't really know what to do in these situations because they've never really
Hmm.
been trained on it. And I think that most organizations and most even interpretation companies also don't really have a great answer. And unfortunately, many times the answer is just do your best and just kind of get through it. But ultimately, yeah, that's not the correct answer, especially in
Yes.
high stakes situations, right? These people that we're talking about potentially life altering, you know, decisions. We're talking about consent for medical procedures. We're talking about the healthcare outcomes for these populations. And that's actually a good segue to kind of advertise to anyone who's hearing this podcast. Maria and I will be in San Francisco in a couple of weeks at the CHIA conference. That's the California Healthcare Interpreters Association. We'll be presenting on this topic specifically, which is the obvious link between Indigenous language access and the best healthcare outcomes. It should be something that's obvious, but unfortunately, something that's sort of overlooked or underrepresented in this field. And so we're going to be talking about these issues specifically, talking about you know the real life consequences of not having correct or adequate interpretation, and then how we can do better to provide Indigenous communities with access to their own languages so that they can have the best possible healthcare outcomes. So if you're in the San Francisco area, this is March 6th and 7th. We will be there and happy to talk to anyone who's interested, and keep advocating. We're also going to be doing a webinar series, at least one this year, where we are going to talk about this issue specifically and help train speakers of more dominant languages on how to recognize signs of limited proficiency in your language pair, and then what to do, and how to go about it appropriately in a way that kind of takes on more of the advocacy role of the interpreter. So lots of good things to look forward to. Again, so very excited to have you, Maria, as a co-chair for this work group. I'm really excited for the insights, the knowledge, the experience that you will bring specifically, and very excited to have you as an inspiration to other people that speak Indigenous languages and maybe are new as an interpreter for an Indigenous language or considering becoming an interpreter. And so, as a final kind of question for you, um, what would you say to somebody who is maybe thinking about becoming an interpreter for an Indigenous language, but is maybe on the fence? What words of advice would you give to someone in that position?
I would say that we need you. So get on board, get the training, get your feet wet, and get all the a hold of any training materials as much as you can, because we need you on our team. We need you to help our communities who are needing the support of language access.
Yep. Amazing. And speaking of training, I think that's another huge issue where we are really lacking when it comes to Indigenous languages. If you're looking to be a Spanish interpreter, there's all kinds of trainings, there's all kinds of glossaries, all kinds of materials that you could use to, become an interpreter. And I think one of the issues that I see a lot of people is they say, well, I'm a little too nervous to become a medical interpreter because I don't know how to say things in my Indigenous language. And so that's another thing that Maria and I are going to be doing in the not too distant future is hosting a webinar specifically for speakers of Indigenous languages on how to be confident as an interpreter, specifically a medical interpreter, but really it applies to legal interpreting, any other type of interpreting, how to be confident in being able to interpret when there is no glossary, when there is no sort of set definition for a lot of different terms we have to use, how to, effectively navigate that by describing things and putting a lot of the burden of that description on the provider, the healthcare physician, the legal expert, making them explain things and break things down in a way that we can then interpret into our Indigenous languages. So we'll be doing
Yes.
that in the not too distant future. Um, and then we also have some other exciting things that we hope all of you will participate in terms of surveys that will help us to start highlighting some of the experiences of interpreters in dominant languages and encountering individuals that have limited proficiency in those languages. So please stay tuned for all of that and stay tuned for lots more interesting and cool things. Our next interview that we're going to be doing together will be with a gentleman named Devin Gilbert, who has worked with Maya Bridge to create a series of practice dialogues in 8 Guatemalan Indigenous Mayan languages. So we're really excited to talk to him next month. So please be sure to stay tuned for that. In the meantime, if you are interested in working with us in any capacity with the Languages of Lower Diffusion work group, please reach out. You can always reach out to myself at my work email through MayaBridge, which is just mgmt@mayabridge.org. And we would be happy to have you to work with us and continue to further this message and this advocacy. So again, Maria, thank you so much. Very excited to have you and excited for awesome things to come.
Thank you, and thank you for NCIHC for the opportunity. And like Jace mentioned, for anybody who's in the San Francisco area for CHIA, please come join us, and we would like to meet you and share and bring awareness. So hope to see you in San Francisco, and thank you again for the opportunity, Jace.
Okay, well, thanks everyone, and we will see you next month.